Yes, I'm hearing you great.
Good afternoon, and thank you for joining us for this community briefing on COVID-19 and our local response to prevent the spread of COVID-19. Joining me again is interpreter Sharon Sinkler. Thank you so much, Sharon, for joining us today, and thank you to all of you for tuning in and for the media for covering this important public health information. We want to remind everyone that you can visit our website, covid19.lincoln.ne.gov, for up-to-the-date information about the pandemic and ways that you can protect yourself, your loved ones, and our community. The dashboard at our website provides latest information on our numbers and is updated twice a day, once in the morning and once in the afternoon. To give you some sense of where we are today, we'll share that we have had a total of 92 individuals test positive for COVID-19 in Lincoln. Reports of 30 of these lab-confirmed cases came through late last night and were included in this morning's report of 79 cases earlier this afternoon. Since then, we've had an additional 13 cases, bringing today's report to 92. Of our community's grand total of 394 lab-confirmed cases in Lincoln, 238 of those, or about 60%, have been reported in the last 7 days. One of the reasons for the higher volume of cases that we are seeing right now is the outbreak at the Smithfield plant in Crete. Health Director Pat Lopez will share more insights on that in just a few minutes. Another factor, of course, that we want to acknowledge about the increasing number of cases in our community has to do with the increased availability of testing. We did, last week, double our local testing capacity from 150 per day to 300 tests per day. The Bryan Health and CHI Health St. Elizabeth drive-through testing sites completed 535 tests in the last 3 days alone. And those sites also completed 1,300 tests last week, the highest weekly total, which is great. This accounts for nearly 1/3 of all the tests that have been completed over the last 7 weeks here in Lincoln. Still, we do have the capacity to do more tests, and we urge you to seek one if you have symptoms of COVID-19. The CDC's expanded list of symptoms includes fever, cough, shortness of breath or difficulty breathing, chills, repeated shaking with chills, repeated muscle pain, headache, sore throat, and a new loss of taste or smell. The process to seek testing starts with an online risk assessment at chihealth.com or at bryanhealth.com. And now, here to provide more details on our local investigations of folks in our community with COVID-19 is Health Director Pat Lopez.
Good afternoon. In addition to seeing an increase in the number of positive cases, we've also seen an increase in the positivity rate. This too was expected as we began testing more widely of those with symptoms. The overall positivity rate for Lancaster County is now up to 8.3%. Of all the tests completed between Sunday, April 26th through Saturday, May 2nd, about 14.4% came back positive. The state's positivity rate is also up to 17.3%. The national rate is down slightly to 18%. Last Friday, we reported 9 Lancaster County residents who were hospitalized with 3 on ventilators. Today, the hospitals report having 10 Lancaster County residents hospitalized with 3 on ventilators. Last Friday, we also had 40 patients from outside of Lancaster County and Lincoln hospitals with 7 on ventilators. Today, we have 38 COVID-19 patients in Lincoln hospitals who are from outside the county, and 8 of those are on ventilators. Even though we've seen an increase in new positive cases, Lincoln Hospital's capacity is healthy. As a testament to this fact, elective surgeries have begun in limited capacity today. Again, hospital capacity is a major factor in determining our pandemic response. Another factor is the ability to complete contact tracing. Our staff continue to work many hours to do contact tracing of all these positive cases. These investigations are key in controlling the spread of the virus locally. Staff are looking to make connections to previous cases and to locations that may be areas of more concern. So far, the largest area of concern for Lancaster County residents has been the outbreak at the Smithfield plant in Crete. Although that plant is in Saline County, we have many Lancaster County community members who work there and who carpool to and from work. That increases the opportunities for contact. And while we recognize there may be many challenges to driving separately, we want to discourage carpooling at this time with people outside of your immediate household for your own safety and to reduce the risk of infection. Through our contact tracing, we've identified 123 Lancaster County residents who have tested positive for COVID-19 related to the Smithfield plant. Of that number, 71 are employees of the plant, and 35 are family members or close contacts. We are still investigating 17 cases. As the mayor said, these cases have contributed to the recent increase in new positive cases we have experienced here in Lincoln. Of the 394 cases we have seen in Lincoln, 123, or 31%, are connected to the Smithfield plant in Crete. We are working closely with these families to ensure that they have the resources they need to isolate and remain at home. Fortunately, we've been working closely with the Smithfield-owned plant here in Lincoln and have identified just 7 positive cases related to the plant at this time. 4 are employees and 3 are immediate family members, our close contacts. As we look at the possibility of loosening some restrictions here in Lincoln, we will be carefully considering all of the data that I have shared through today and that we received throughout this week. In the meantime, the Health Department has proactively posted some draft guidance that we mentioned last week. And this guidance for different types of businesses on the COVID-19 website asks for additional input. We received some great feedback, and we are now reviewing and evaluating how these guidelines might be revised to both accommodate business needs while protecting the public and the workers. We're doing this so that when the decision is made on when to ease restrictions, we will have done a great deal of groundwork necessary to ensure that businesses are prepared to resume their operations as safely as possible. Most businesses have really been quite proactive and incredibly receptive. It is clearly understood that any loosening of restrictions will be done with the health and safety of the public and the people who work in these services in mind.
Thank you, Director Lopez, and thank you to our business community and to all those who provided that important feedback on these draft guidelines. Our businesses have worked with us since the beginning of this health emergency, and they have been extremely understanding and cooperative. They have set a great example in our community of a caring and civic spirit. Given the outbreak in Crete that has the potential to impact our city's level of community spread COVID-19, it is incredibly important now that we continue to follow the recommendations of our health department and local health officials to protect ourselves, our loved ones, and our community. Stay home as much as possible, leaving only for essential trips to get food or medicine or exercise. If you do have to go out, wear a face covering and keep 6 feet distance from others out in public. Wash your hands with soap and water thoroughly and frequently, especially after touching frequently used items or surfaces. Avoid touching your face. Sneeze or cough into a tissue or the inside of your elbow. and disinfect frequently used items and surfaces as much as possible. These methods of preventing transmission of the virus are absolutely crucial and will be so for weeks to come. Now is not the time to let down your guard. Each of us is a vital link in the chain of protection encircling our community. Be a strong link in that chain. One of the many reasons we are focused on containing the coronavirus is that the success of our economy depends upon it. We know that the economic impacts of the pandemic already have been devastating, particularly as we've witnessed many of our friends and neighbors lose hours or their jobs. In an effort to provide more information about how to access assistance for those who are economically vulnerable right now, we will turn to the topic of unemployment. In Nebraska, the number of initial unemployment insurance claims rose from about 500 per week in the weeks prior to the pandemic to over 25,000 claims per week at its height during this pandemic, a 5,000% increase. We've seen a similarly stark increase in claims right here in Lancaster County. While the number of weekly unemployment filings in Nebraska and Lancaster County have since decreased from their peak levels, they still far exceed pre-pandemic levels. To address the economic impact of COVID-19, the federal and state governments temporarily expanded unemployment compensation by temporarily increasing the number of people eligible for unemployment benefits, increasing benefits by $600 per week, extending benefits for an additional 13 weeks, and waiving some requirements that ordinarily apply to unemployment compensation. And while the Nebraska Department of Labor and not the City of Lincoln is responsible for administering unemployment insurance compensation, we here at the city have worked to support their valiant efforts by posting relevant information on our website and by distributing one-page unemployment compensation information sheets through many different distribution channels. Here to elaborate on how unemployment insurance has changed in light of COVID-19 and here to discuss some questions that have emerged around this process is Nebraska Department of Labor Commissioner John Albin. Thank you so much for joining us today, Commissioner. We're glad to have you here.
Thank you for having me here, Mayor Gale there. As the mayor mentioned, the federal and Nebraska state government temporarily expanded unemployment compensation in a number of ways. First, eligibility. More people are eligible for unemployment benefits than they were before, including self-employed people, part-time workers, independent contractors, furloughed workers, and others who cannot work as a result of COVID-19. Note that these benefits are intended for people who were laid off through no fault of their own or who cannot work due to COVID-19. Second, there was an increase in benefits. The CARES Act provides an additional $600 per week in unemployment benefits on top of your baseline benefits. This additional $600 per week is being issued for eligible unemployment weeks, starting with the week ending April 24, 2020, and concluding with the week ending July 25th, 2020. Third, there was an extension of the benefits period. Normally, unemployment compensation in Nebraska runs for 26 weeks. Now it can run for up to 39 weeks or an additional 13 weeks. Fourth, there are several waivers in effect that are intended to make it easier to obtain unemployment insurance benefits than it was before. The requirement that a claimant must search for work to be eligible for unemployment insurance benefits has been temporarily waived, as has the requirement that the claimant have one unpaid waiting week before receiving benefits. In addition, NDOL has temporarily waived charges incurred by employers for unemployment claims related to COVID-19. These waivers are currently in effect until August 1st, 2020. Many questions have arisen concerning the administration and payment of unemployment benefits. While I cannot speak to all of these questions now, I encourage you to visit the Nebraska Department of Labor website for more information. In the meantime, there are a couple of things you should know. To apply for unemployment benefits, go to anyworks.nebraska.gov and register for an individual account. The Nebraska Department of Labor has put together helpful instructional videos designed to walk you through this process, as well as a step-by-step claim instructions document. To receive unemployment benefits for multiple weeks, you must file an initial claim and then a weekly claim for every week that you are unemployed. Make sure to file weekly claims even while your initial claim is being processed. NDOL's step-by-step instructions document includes instructions on how to file both an initial claim and a weekly claim, as well as instructions on how to check the status of your claim at anyworks.nebraska.gov. Ordinarily, it takes 21 days to process a new unemployment insurance claim. However, due to the current volume of claims that the Nebraska Department of Labor is processing, delays may occur. NDOL has taken in the equivalent of 3 years' worth of claims in 2 months, and NDOL has paid out 2 years' worth of claims in that time. Nonetheless, going forward, there's good reason to believe that the processing times will speed up because the governor just signed an executive order that allows NDOL to verify a claimant's job history by contacting only the claimant's most recent employer, as opposed to requiring NDOL to contact all the claimant's employers within the past 18 months or so, which can take a long time. Also, NDOL just implemented a new software to expedite claims processing and added more staff support. Finally, for additional assistance with your unemployment insurance questions, email your questions along with your contact info to ndol.nichelp@nebraska.gov. You can also call the unemployment insurance hotline at 1-855-995-8863.
Thank you so much, Commissioner Albin. We are so grateful to you and your team at the Nebraska Department of Labor for all the work you're doing to support Nebraska residents and businesses during this incredibly difficult time. I'm sure it's involved countless hours and constant innovations on your part. So thank you again for everything you're doing. And thanks for joining us today to share this really valuable information. Yeah. For more information, you can also visit the city website, covid19.lincoln.ne.gov, and check out the unemployment assistance section of our resident resources page. We also want to note that the American Job Center, located inside Southeast Community College's Education Square at 1111 O Street, is open and available to provide assistance to individuals with navigating the unemployment insurance application process. You can reach the American Job Center by calling 402-413-9236. And if you decide to go to the Job Center for the purposes of registering for unemployment benefits, please make sure that you bring your driver's license or another form of valid ID, your social security number, your banking information, if you want your benefits directly deposited into your bank account, and your contact information. And while the Job Center can help you navigate the unemployment insurance application process, they cannot tell you whether or not your claim will be approved or when you will receive payments, just something to note. And in addition to providing assistance in navigating the unemployment insurance process, the American Job Center offers job search and job applications assistance, which is especially important given that the expanded unemployment benefits available right now are only available for a short period of time. There are many businesses still hiring right now, and you can learn more about these opportunities by contacting the Job Center or by attending the drive-through job fair that will be held tomorrow from 10 a.m. to 2 p.m. at Gateway Mall. The way that drive-through job fair will work is that you drive to the mall and someone will hand you a bag of information while you remain in your car. And that bag will contain currently available job openings and ways to apply. 50 local employers have provided information for this job fair, ranging from manufacturing to construction to healthcare and more. I really want to thank Gateway Mall, the Lincoln Partnership for Economic Development, EmployLink, and Brian Seck for orchestrating this innovative and safe way for job seekers to connect with opportunities. And finally, we want to turn to some good news. We recently surpassed the 1 million mark in funds raised for the Lincoln COVID-19 Response Fund. To date, $668,500 have been granted to 49 local nonprofits working to support the basic needs of vulnerable and newly vulnerable Lincoln residents, including access to food, housing, medical information, childcare, and other support. We are deeply grateful to all the people who have contributed to date, and we encourage those who are in a position to do so to donate and help mitigate the impact of this pandemic. The impacts of this pandemic will be felt for some time, and if you are in a position to give, please go to the portal at lcf.org, that's the Lincoln Community Foundation's website, and give. This is a marathon, not a sprint, and we need your help. In other good news, Bright Lights has decided to move some of its famously enriching summer camps online so that students may take advantage of these wonderful opportunities from the safety of their home this summer. More information can be found at brightlights.org. And finally today, it's another Sunshine Monday. We are again sharing some of the beautiful art that's been created by Lincoln children as part of our Sunshine Kids for Seniors project. Aging Partners is helping children connect with our homebound seniors by sending notes and artwork. If your family would like to participate, you may send your scanned notes and artwork. Please limit to first names only if you sign the art. And we will get those, if you email those to sunshinekids@lincoln.ne.gov, we will make sure they are sent to seniors to help brighten their days. And with that, I'd love to open it up for questions.
Mayor Gaylor Baird, this is Joanne Young at the Journal-Star.
Hi, Joanne.
I have a question. I think it's for Pat Lopez.
Okay, she'll be right up.
Okay.
Good afternoon, Joanne.
Hello. So my question is, what's the obligation of healthcare centers and businesses to tell employees when someone tests positive for COVID? And in some cases, maybe even who that person is so that the workers are able to know if they've been exposed. And you guys, do you at the health department, are you informed of those people that test positive at like a assisted living or a big store, for example?
Yes, anybody who's positive, we're informed about. Then, depending on where they work, when we're doing the contact tracing, we reach out to the employer after we gain information and provide guidance to them and instructions about what they need to do if there's other employees that need to quarantine. Once we learn more about the work environment and who might be exposed, we provide guidance to them about who needs to quarantine.
So is it up to the facility to tell the workers, or are they required to tell the workers?
We follow up with them to make sure that they've told the workers and that people are quarantined and isolated, and we do follow up with them.
Okay. And if there's a business that the public goes to a lot, I know that it used to be telling where people had, and that's not the case anymore.
Well, initially, you might have seen that happening in Omaha, and if you think, it seems like months ago, but it really hasn't been. When we had our first case, they were talking in order to mitigate, when there were those first couple of cases that were out in the public, they were telling the public where the person had been to alert people to be aware of any symptoms they might be experiencing and for them to get tested. What's happened after we've had so much community spread now, we have to assume that COVID is everywhere that we're at. And also in our community, we had the advantage of being a couple weeks behind everyone. So we learned from what was happening in other parts of the United States and internationally, as well as what was happening in the Omaha area. And we were able to provide education to our community members. And what we found is that most of our community members were already self-quarantining and really hadn't gone out and had a lot of contact and hadn't been going to work and exposing others. The people exposed were their own family members, our immediate close contacts.
Okay, thank you.
Mm-hmm.
I have another question for the mayor, actually.
Hello again.
Hi. So the churches are going to open up again this weekend, or maybe some of the Lincoln churches are going to wait until the next weekend. And I'm just curious about, with the cases still rising and so many tests showing positive, what your thoughts are on the churches bringing people back into to be together.
Sure. Well, as you know, we've worked with the state to extend our current directed health measures that prohibit public gatherings of more than 10 people from May 6th to May 11th. And we felt that that was important because we are concerned about the trends in Lincoln, and we want to get a handle on that outbreak in Crete. And when you consider what's being done with houses of worship, it's an exception to that public gathering rule. It's the one exception. And I think we can all understand that's probably coming from a place of wanting to, people are very much wanting to be in community and to worship in person, that is a very personally important aspect of life to so many. But we have heard the governor say, and we will echo the governor, that we absolutely discourage that anyone who is in a vulnerable population, if you take a pill once a day and have an underlying medical condition, if you are an older adult, if you are in any way vulnerable to this virus, that you should continue to worship from home, that this is not the time to be resuming in-person worship services if you are vulnerable to this virus. And we are actually convening faith leaders in our community this week. The health department and I will be speaking with them to learn more about their plans to provide guidance that is in line with the health department recommendations for physical distancing. While there are, of course, clear guidelines about keeping 6 feet apart and just having your household members sit together while in church or temple or mosque, there's real concern about what happens as people are entering and exiting the buildings. And part of what makes the experience of going to in-person worship so valuable is that contact with others. We don't want that right now. We don't want people to be in close contact with people who are outside of their household. So again, we are discouraging public gatherings that are of 10 or more, more than 10 people, and really recommend that people give a lot of careful consideration as to how important it is to them to go back to in-person worshiping at this time.
Thank you, Mayor.
Hi, Mayor and Pat. This is Bill with 1011.
Hey, Bill.
You made it sound in the beginning like that May 11th date is still very much under evaluation here in Lincoln. I know last week you said you guys do have the right to reverse course. With a surge in cases, is it advisable right now for hairstylists to make appointments and for restaurants to take reservations on May 11th?
I wish that we could provide more certainty to everyone in our community right now. That is, of course, one of the most difficult aspects, is living with ambiguity. But we are, of course, seeing concerns right now in our positivity rate and our case numbers and an outbreak that is adjacent to our community. So we are very much still evaluating the date for reopening those businesses, and we'll be having conversations with the state and amongst our health team and our other local officials about what makes sense for Lancaster County.
I have another question. This is about testing. Is there any thought on testing asymptomatic people? I know you are encouraging everybody right now, whether you're high risk or not, if you have symptoms, get tested. But is there any thought on eventually testing the general population?
Is the ultimate goal. We want to get to a place where we can test people who are asymptomatic, because we know that this virus can be shed and spread by people who are asymptomatic. So that is where we want to move, and we are very pleased by our work with our local healthcare providers. Brian and CHI St. Elizabeth have worked so hard to increase testing. We've worked with the public health lab at the state, and we are so grateful for the increased tests made available to us by the state. And the promise of Test Nebraska is that we will have even more testing locally at some point soon. But it's going to take very much a larger amount of increased available testing for us to get to the point where we can open it up to get a real sense of the prevalence of COVID-19 in our community, and to be able to say that anyone who wants a test can get one. And of course, we would like to be in that place, but we're not there yet.
Thank you.
Mayor, this is Diane, and I have a question that was texted to me from let's see, Brent, I believe, at Channel 8.
Okay.
And this is for Pat. With regard to the Smithfield plants in Lincoln and Crete, can Director Lopez comment about why there are so many more cases in Crete than there are in Lincoln? Is it because there are more workers, or are there differences in protocols and PPE between the two facilities?
Oh, Diane, I can comment for them about the Lincoln plant because that's the one I'm familiar with and what protocols and practices they have in place. But that's a really great assumption about looking at the number of employees. So we have 400 employees in Lincoln, and they have 2,100 employees in Crete. And I'm not familiar with how things are set up in the Crete plant. I do know that the health director at Public Health Solutions arranged for an on-site visit with a team that's developed some protocols, if you will, a roadmap for meatpacking plants of things they can do for quality improvement. And I haven't talked to her in detail about that, and she would be the best resource. Anything I know is just secondhand. But I do know that our Lincoln plant has done a very good job and has done a great deal to really protect their vulnerable employees there as well.
There are other questions from the media? Bill, just as a follow-up, we will work to have an answer to that question about the May 11th date later this week. That is our goal, to have more certainty for the affected businesses. We do want to have an answer for them, but we do want to see this week's data because as you can see, there have been incredible variations in it recently, but the overall trend has been a rising upward trajectory of cases. Any other questions? All right, well, thanks again to Commissioner Albin for joining us, and thank you to all of you for doing your part to help keep our community safe, stay home, stay connected, and we'll see you again tomorrow at 3:30.